Singabako, good morning. Let's talk a little bit about the situation in the country's prisons now. When we first spoke many months ago, there was the concern, it's the well-known concern, of overcrowding in prisons and how to handle social distancing and COVID protocols. How do we look on the 30th of December 2020?
A very good morning, Gareth, and thank you for having us. I must say that it is true that around March this year, there were a lot of reports, people saying that the situation will look really bad in correctional services. And we said to the people, look, we are prepared for this. We will put up a serious fight. And indeed, we have done that. To date, we've only had cumulatively 8,462 people have tested positive for the virus. And officials account 5,418 of that number. Then inmates that will talk to 3,044. Unfortunately, we have lost 153, 94 being in officials and 59 being inmates. And I think all earlier reports were pointing towards inmates being, likely to be the worst affected. But reality has shown that our officials are the ones who are more vulnerable. And understandable so, because they stay in the same communities where the virus, is quite vicious. Hence, then we've lost this number. But as a department, we said, look, we've got a strategy in place that we've been utilizing. We continuously, adjust it, as we move along. And now we've said, okay, how do we then face off with this new variant? And again, the measures that we're putting in place now are to say, the risk adjusted must pay attention again on prevention measures, because we strongly believe that is where the battle is won. But you will know, me and you, that eventually people do get infected. Then the question is, how do you then handle that particular situation?
And I'm curious, and I'm so glad you brought that up, Singabako. I'm curious to know how you are actually handling the social distancing within the prison. I think members of the public who don't go to any kind of correctional services facility can't understand. We can't kind of envision how this looks inside a prison. So take me through one of the largest prisons, if you can. How is this all being managed?
You will recall that in December of 2019, there was special remission of sentences, which reduced overcrowding in correctional centers quite significantly. Then in 2020, we had a special parole dispensation, which really assisted us, because now we could at least then reduce those numbers by more than 15%. Our inmate population now, you will not believe it, is below 140,000. So to be exact, we are in the region of 136,000, which does indicate that, those numbers, have gone down. Point of concern, though, is the number of remand detainees, those trial awaiting, because those people come to our facilities on daily basis. I think it talks to, the conduct of our people. If you engage in crime, definitely you will be arrested and you'll be brought to our facility. But we said even those people that we're admitting now, we isolate them for a period of 14 days. And once they are received a clean bill of health, we then move them to the general inmate population as, again, a measure of making a point that if even, let's say, someone was asymptomatic, that person, it doesn't, infect other people there. But what we've been doing on a daily basis is the issue of daily screening, because to us that is very important. This talks to officials, inmates, and every individual accessing our facility. The correct usage of personal protective equipment. We are no longer talking about its availability. We've long passed that. It's there, it's available, we have sufficient supplies. And also, again, the issue of continuous communication. We fully understand, COVID fatigue, where people now, others, tend to, put their mask down. Others no longer sanitize, regularly. To say, wash your hands regularly. We've got to sanitize. And again, even to say management must also even do supervision in terms of what's happening then.
Singabako, forgive me for interrupting. I'm so glad you brought up the word mask. I think you know what I'm going to ask you now. Did you get a bit of a fright when your boss announced that anybody caught without wearing a mask in public could end up in prison? What did you think of that statement, and is that even realistic? You could end up with thousands of South Africans being brought to your facilities for not wearing a mask. How could that even be possible? Do you even have that kind of capacity?
I think it's a message that goes to the people out there to say, you've got to, take it seriously that, what, a mask, it's one of those measures which will really assist us in terms of managing, the spread. And then, unfortunately, people who don't abide, by these regulations, then they will have to be dealt with. I think we are I think correctional services, it's the last line in terms of the justice system. We'll have to really, make space, to accommodate those people. But ordinarily, we will want to have such people in our facilities, but if you break the law, unfortunately, you'll be brought to our facility, and then we will have to treat you as such. But then, as a department, we say, let each and every person, play his part so that, all of us, we can fight this battle and win it. But if some believe that, what, they are immune, they will not get, this virus, then they are only fooling themselves. So hence, then as a department, we say, whoever that is brought to us by the SAPS or by the courts, we've got to really, isolate them for that period of 14 days. Otherwise, those people are likely to infect the general inmate population and also infect our staff members, and we do not want that to happen.
Of course we don't. And I appreciate your time in always speaking to us, and all the best for the festive season to you. Singabako Nxumalo, Department of Correctional Services, joining us here on ENZ.